Okay, I've performed proper hand hygiene and I will be going into the room to do my head to abdomen assessment. Hi, my name is Roseanne. I'm going to be taking care of you today.
Hi.
What is your name?
Daisy Jacks.
Good. When is your birthday?
January 10, 2008.
Great. So when I come in, I'm just assessing her posture, her position, how she's sitting on the table, her language, her articulation. It all seems to be okay. At this point, I could probably look at her skin. I'm noticing her skin is nice and pink. It's warm. Cap refill is a pretty brisk 3. I don't see any bruises. I don't see any scarring. I don't see any nevi. There's no clubbing. She's nice and pink. Looks good. I would check my vitals. I would do blood pressure, pulse, respirations, and temp. But the most important, are you in any pain today?
No.
Okay, so no pain today. I'm also looking at her head for hair distribution. I'm gonna look for infestations. I'm gonna feel for any masses, any bulging, see if she has any tenderness in there. Sorry, I'm messing your hair up. I'm also looking at her neck for some symmetry. Her carotids look symmetrical. I'm not seeing any obvious masses, anything like that. I'll go on to do my lymph node assessment. So preocular, postocular, submandibular, submental, tonsillar, missed that one, occipital, she does have a little bit of lymph node enlargement. Daisy's had strep. Cervical. I'm looking at her trachea. Her trachea doesn't seem to be bulging. Can you swallow for me? Atta girl. Doesn't feel abnormal at all. Her carotids don't feel abnormal. I would listen to her carotids for a bruit. I don't hear a bruit. So at this point, I would have her stand up and walk for me. If you can walk across the room and come back. There you go. Walk over here. Good. Go ahead and have a seat. So her gait and her posture seem pretty normal. I don't see anything abnormal there. I would move on to continuing to assess her. Can you touch your chin to your chest and move it up? Atta girl. Okay, nothing abnormal there. Like I said, her carotids look good. Her thyroid gland looks good. I don't hear any bruits in her carotids. Her neck looks good. No masses, no bulges. It's symmetrical. Her gait was fine. At this point, I want to assess her 6 cardinal fields of gaze. If you look at my finger, watch my finger. Don't move your head, just move your eyes, okay? Very nice. This is to assess cranial nerves 3, 4, and 6. That all looks normal. Her eyes look symmetrical. Her eyebrows look symmetrical. I don't see anything there. Her nose looks good. Let me see, her eyes. So my otoscope somehow got lost somewhere. I think it got thrown away the other night. So this is my flashlight. I would check her eyes for perla to make sure her pupils were nice and reactive to light. I would shut the light off, turn the light on, make sure her pupils reacted when I put the light to her eyes. At this point, I could also check her red reflex. I would hold the flashlight back and look into her eye and make sure I saw red or orange on both eyes whenever the lights were off and the the light was on her eyes and the light was off. I would now go to her ears. So I'm gonna, if I had my otoscope, look into her right ear, make sure her tympanic membrane is gray. It looks good. It's probably at about 5. Make sure there's no drainage. Left ear the same. Gray, nice tympanic membrane. The light's at about 7. Make sure her ears are symmetrical, the auricle is symmetrical to her eyes, which